Structure of tear film. Wolff was the first to describe the detailed structure of the fluid covering the cornea and called it precorneal film. He described this film to consist of 3 layers, which from posterior to anterior are mucus layer, aqueous layer and lipid or oily layer. 1. Mucus layer. It is the innermost and thinnest stratum of the tear film. It consists of mucin secreted by conjunctival goblet cells and glands of Mans. It converts the hydrophobic corneal surface into hydrophilic one. 2. Aqueous layer. The bulk of tear film is formed by this intermediate layer, which consists of tears secreted by the main and accessory lacrimal glands. The tears mainly comprise of water and small quantities of solutes such as sodium chloride, sugar, urea and proteins. Therefore, it is alkaline and salty in taste. It also contains antibacterial substances like lysozyme, betalisine and lactoferrin. 3. Lipid or oily layer. This is the outermost layer of tear film formed at air-tear interface from the secretions of meibomian, Z's, and Mal glands. This layer prevents the overflow of tears, retards their evaporation and lubricates the eyelids as they slide over the surface of the globe. Functions of tear film. Keeps the cornea and conjunctiva moist. It provides oxygen to the corneal epithelium. Washes away debris and noxious irritants. Prevents infection due to presence of antibacterial substances. Facilitates movements of the lids over the globe. Secretion of tears. Tears are continuously secreted throughout the day by accessory, basal secretion, and main, reflex secretion, lacrimal glands. Reflex secretion is in response to sensations from the cornea and conjunctiva, probably produced by evaporation and breakup of tear film. Hyperlacrimation occurs due to irritative sensations from the cornea and conjunctiva. Afferent pathway of this secretion is formed by fifth nerve and efferent by parasympathetic, secretomotor, supply of lacrimal gland. Elimination of tears. Tears flow downward and medially across the surface of eyeball to reach the lower fornix and then via lacus lacrimalis in the inner canthus, from where they are drained by lacrimal passages into the nasal cavity. This is brought about by an active lacrimal pump mechanism constituted by fibers of the orbicularis, especially Horner's muscle, which are inserted on the lacrimal sac. When the eyelids close during blink, contraction of these fibers distends the fundus of the sac, creates therein a negative pressure which siphons the tears through punctum and canaliculi into the sac. When the eyelids open, the Horner's muscle relaxes, the lacrimal sac collapses, and a positive pressure is created which forces the tears down the nasolacrimal duct into the nose. Therefore, in atonia of sac, tears are not drained through the lacrimal passages, despite anatomical patency, resulting in epiphora.